Hey, everybody, welcome to another episode of Disability Landscape. I'm your host, Charlie Bros. With me, as usual, is my co host, Mark Knutson. Mark, tell our fans what we have today for them.
Well, today we are going to talk to an individual from the Minnesota Council on Disability to first understand what the Minnesota Council on Disability is all about. But he is the policy director there at the Minnesota Council for the Disabled. So I'd like to welcome Trevor Turner.
Hello, everyone.
Hey, Trevor, how are you? And if you could just, I know there's quite a few aspects to the Minnesota Council on the Disabled, but if you could give a kind of a sense of what the Minnesota Council of Disability is all about.
Absolutely. So the Minnesota Council on Disability is a state agency. It's an independent state agency. It's not an executive branch agency or a department of any of the other state agencies. We are our own, and we are tasked with representing the disability community and providing counsel and guidance on disability issues and affairs for the governor's office and the legislature. And then, of course, we also are one of the few state agencies that are tasked and have the authority to lobby on behalf of the disability community in Minnesota in the state legislature.
And how many, with the council, there's kind of like two components of it. First of all, there are you and some other individuals who work for the state. How many people are actually that works for the Minnesota Council on the Disabled?
So our staff is, we like to say that we're small and scrappy.
Yeah.
We, I would, roughly maybe 7 or so of us, give or take. And then, of course, we have our council, who are all appointed by the governor. And they represent different regions and different parts of Minnesota. And they are the ones that approve all the activities and things we do and provide guidance to the governor as well.
And what are these council members made? Are they advocates for disability? Are they disabled persons themselves? What are the council formed of?
Our council is formed of mostly of people who have disabilities themselves, that identify as someone part of the disability community. Some of them are also advocates, parents of someone with the disability, and some of them are even elected officials in their communities. And so they are made up of a wide variety of people, and we try our best to recruit a wide range of disabilities too. The disability experience is very diverse. And so we want to represent that as much as possible.
Okay. And when somebody achieves or is appointed to the council, how long do they generally serve on the council?
It's a 1-year term. Yeah. And then usually most people tend to do another term as well.
And then when someone is selected, if I remember correctly, aren't they kind of represented throughout the whole state? So it's not like you've got 7 from the Twin Cities area and 3 outstate. Aren't they kind of all representing a geographical area?
Yeah. So they each represent a different geographic area of the state of Minnesota. The line maps are drawn. So it's actually a physical boundaries for each person. Representing southern Minnesota, the greater Minnesota, northern Minnesota, and the different parts of the Twin Cities.
So,
go ahead, Charlie. I think you had.
Yeah, no problem. In the regions that are there specific regions? How are they drawn? Are they close to like the legislative districts that we have in the state, or how's that made up?
They're not quite the same as legislative districts. Obviously, our council is a lot smaller, so the regions are a lot bigger. But they try to get a good representation of the state as possible. So
okay.
And when can an individual represent more than a year? Can they be you said they have 1-year terms, is that correct, or was I wrong?
Yes, that is correct.
But
And can they then,
don't-
There's no term limits or anything like that, so you can continue.
oh, they
to
can
represent.
continue on that. So what's the average length someone, once they get on, do they tend to stay there for a while?
I think there's, I think people tend to stay. I think there's also a little bit of turnover. I mean, it is a commitment. I mean, it's not
Right, yeah,
thing do once or twice a year and meet. It's a commitment. You're representing the disability community, and they're expected to represent their areas, and they're also expected to meet with legislators, meet with the governor, and I, as a policy director, I meet with many different legislators, senators, and representatives, and sometimes I rely on our council members to connect me with their local reps and their senators and things like that. So it's definitely a commitment. It's volunteer, but it's a commitment.
Okay, and the members that are on here, I know probably pre-COVID, did they actually meet in person in a certain location, or was it virtual sort of beforehand?
Yeah, pre-COVID, there were physical meetings, they'd come down to the Twin Cities, come down to St. Paul, and, and of course, their board and lodging would be covered and things like that. And they were expected to have all-day meetings. But obviously with COVID, now everything is done virtually. And I personally think, after a year of this pandemic, and people are quite used to doing things over on Zoom or on Teams or whatever. And so
whatever, yeah.
it actually, I'm sure a lot of us are very excited to do in-person things again. But it is a lot more accessible, especially for people with disabilities, to be able to come in on virtually on a meeting. And especially for those who live, up far, up by Moorhead or Duluth, it's quite a drive to come down to the Twin
Yeah.
Cities.
Yeah. Yeah.
It's more accessible. And so I think that going forward would probably be more of a hybrid. Some people come in person and some people would join us virtually.
And then, I know for you, your area is policy, but I would imagine one of the other big areas for the council is, accessibility. You guys, I would assume, get into quite a bit of legislation or just stuff, relating to accessibility throughout the state.
Yeah, so my official title, public policy director, but everyone on the staff is kind of expected to be a jack of all trades.
Right, yeah,
Get involved, no task that's too big or too small for anyone on the staff. And so while I might be meeting with the different senators and representatives of the governor's office, I might also be doing advocacy work and meeting with different disability leaders in different communities and planning events. So I also help do a little bit of event planning and things like that for the disability community as well. And of course, we also provide training, and sometimes businesses will call us asking for ADA, counsel, just to, making sure that they are ADA compliant. And so we actually have an ADA director who works that. And in the pre-COVID times, he actually traveled around the state providing trainings for small
Yeah.
business community, things like that. Now he's doing it virtually, but so we provide a lot of different resources and services, not just policy and advocacy.
So, and do you get involved in like large projects regarding accessibility, like the stadiums and that type of thing, or are you hands off on that?
I think for very, like a building of a stadium, it's not, we can definitely provide, counsel and advice on how to make things like, but generally large scale projects like that would have, many different people and many different organizations involved in making sure from the state level to the city level, to the metropolitan level as well, sort of municipal level, lots of different levels of government and private organizations and nonprofit organizations would be involved in large scale projects like that, not just us.
Okay.
Yeah, because you would get more involved, I would assume, when there needs to be some changes or some big
Mhm.
policy stuff someone may be talking about, and then they would approach you to the Minnesota Council of Disabilities on making whatever ADA changes or accessibility changes in that. Now with the part of the reason, I should say, the main reason why we reached out to you, because it is January. We've got a start of a new session over there at the Capitol, that. And what are some of the what's the legislative agenda for the Minnesota Council on Disability?
Yeah, absolutely. So one of the things that we're really fortunate to have at the Minnesota Council on Disability is that we are, we have statute authority to have the ear of the governor and the ear of the senators and representatives. And so we have a unique position, and the representatives and senators and the governor's office really value our input and our advocacy, and
Okay, interesting.
and they're generally pretty receptive. If I call any senator or a representative or their LA, they're usually pretty quick to get a meeting with me to hear what I think that we should be pursuing this legislative session. And this year, so we actually in December had a public policy forum where we announced our public policy agenda to the disability community and to different legislators. About 15 legislators showed up, and the governor and lieutenant governor showed up and spoke and listened to the disability community and listened to our public policy agenda. So this year, being a budget year, our almost first and foremost biggest priority is to ensure that our budget and all the disability agencies and services remain intact or receive some sort of cost of living and increase of some sort to maintain. Especially our agency, we're asked to do quite a lot, and yet our budget is a flat budget, and it doesn't increase every year. We have to advocate for an increase in our budget. So with the projected potential deficit, there is obviously concern that there's going to be across the board cuts in social services and state services, but particularly those that that a lot of people with disabilities rely on. Or don't obviously want to see those get cut. But the governor last week budget proposal and his recommendation for the budget, and he didn't have any cuts whatsoever for any disability services, and actually many of us saw an increase. So we expect the House to present something similar, and in the Senate we'll see, obviously because opposite party from the governor in the House, they're going to try to pursue a much smaller budget. But in my experience working with both parties, they generally tend to value disability issues and want to make people with disabilities' lives better. One thing I always remind legislators is that eventually, if you're fortunate to live long enough, everybody gets a disability at some point. And so it's whether you want to make life for your parents or your children or yourself better and easy and more accessible, putting disability priorities first will make everyone's lives easier.
Yeah, I quite understand that. And I think that's a blind spot that a lot of people have, that, disability can always be just a blink away, and you have to be prepared or understand that the needs are there. I know one of the hot button things has been for the longest time, PCA care and a minimum wage for that. Has that been achieved, or where are we at on a subject like that?
It has not been achieved. However, it is a priority for not just Minnesota Council on Disability, but also for a lot of different organizations. PCA rate reform is a big one, as well as adjustments for policy for allowing PCAs to be able to drive their clients. As of right now, a PCA cannot drive their clients at all.
Oh,
okay.
More often than not, they do out of the kindness of their hearts, but technically, by law, they're not supposed to. And so, we want to make it easier. PCAs develop a really strong relationship with their clients, and so we want them to be able to do those things, especially take them to doctor's appointment, to grocery stores, and things like that. And we also believe that it's frankly cheaper for the state to allow PCAs to drive their clients because they don't have to rely on, non-emergency medical services or driving or anything like that.
Certainly. Has that been like a liability issue then? Are they concerned about? Is there special riders for insurance they need?
But we actually, that was the question that we get a lot when we're presenting this, policy change. But fortunately, the state already has policies that cover liability and things like that, insurance and things like that. And this one thing that we have to remind people that this priority is not a mandate. It's just, allowing them to do it, giving them permission. So we think that it should be a no-brainer,
Yeah.
especially during times of COVID. More people than ever are relying on their PCAs to get around, and especially with the vaccine distribution and things like that. So we want PCAs to be able to provide those services for their clients.
And do they on PCA care, and just, if I'm overreaching, let me know, but do they require background checks for people in that position?
I actually am not familiar with the process for becoming a PCA, so I couldn't.
I was seeing something that would be a good idea, I think.
With
some sort of background check, but that's only an assumption.
yeah,
Okay.
and and with the COVID now, and that has the council had to get involved in more trying to fight some of the restrictions. I know a lot of the day programs, I believe, have been affected because of restrictions being shut down. And that, are you guys getting involved in quite a bit of those restrictions because of COVID?
The previous public policy director that served in my role, it was actually redeployed for the COVID-19 task force with the governor's office. And so we actually had staff member who's almost, well, not exclusive, but one of his main responsibilities is kind of advising the governor on different COVID-19 and disability issues and how it affects people with disabilities. So, anytime we think that policy or change or anything like that is affecting negatively people with disabilities, we're definitely going to have a word with the
Right.
Yeah, there's quite a few people that use like the day programs. They do kind of sheltered workshop type situations where it gives them the opportunity to be out of the house and do something, and all those have been shut down. And it affects their their mental health, among other things too. So the sooner we can start getting people back, the better it will be, obviously. Can you highlight some of the agenda hierarchy you want for this year?
Yeah, absolutely. So, obviously with the budget concerns, we wanted to stick with policy priorities that had little or no fiscal, notes or anything like that. And so, because we think that it'll be easier to get passed in a split legislature. That is one of the, Minnesota is one of the, I think it actually may be the only state in the country that has a split legislature, with the DFL controlling the House and the Republicans controlling the Senate. And so that requires a lot of bipartisan and coming together. And so perhaps some of the more liberal, progressive or more conservative issues get kind of put to the wayside because we focus on what our commonality and our common grounds are. Unfortunately, this really tends to be bipartisan. It's pretty easy to get support from Republicans and Democrats on both sides, in both the Senate and the House, to support our legislative priorities. So besides the PCA driving and PCA reform, we also had a couple of priorities focusing on rare diseases. So a few years ago, the Rare Disease Advisory Council was established through through statute, and currently being facilitated through the University of Minnesota. But as of right now, they are more serving as advisory and advising the medical staff and the medical professionals and the research and academics and they are not taking any policy priorities when it comes to rare diseases. And so they have to rely on the council to kind of push for and advocate for anything regarding rare diseases. So we're actually pushing for some clarifying language to allow the Rare Disease Advisory Council to, take policy positions, to hire
Okay.
policy director, things like that, because so many disabilities are caused by rare diseases, including my own. So I have Usher syndrome, so which manifests itself as a severe hearing loss and visual impairment. So
Oh, okay.
I don't drive or anything like that, and it's not. And I wear hearing aids. It's not very common. In fact, up until 2019, I had never met a single other person with Usher syndrome in my life.
Wow.
Really?
I had to go to Philadelphia to an Usher syndrome conference to meet other people. And there I actually met a few people from Minnesota. So we've actually been able to connect in Minnesota. Fortunately, the connectivity of the internet and things like that, and councils like the Rare Disease Advisory Council is starting to bring together people with rare diseases, and then allow them to become more an advocacy force. And so if they're able to advocate and lobby legislators, then perhaps we can get a lot more funding and a lot more programs that support people with rare diseases. So that's one of our policies there. And then, of course, and again, with the rare diseases, we're also supporting policy change regarding health insurance. The average wait time for somebody with a rare disease from when they first go to the doctor to when they're formally diagnosed, about 7 to 9 years. For me, it was 9 years.
Wow.
And a lot of you're going through a lot of bureaucratic and hurdles through insurance and meeting medical providers and staying within your network so that you can
Yeah.
afford it. And so we're trying to pass a policy change that allows people with rare diseases to go straight to a specialist, cut out the middleman and get the diagnosis and the treatments that they need directly, regardless if the provider is in their network or not. I mean, one of the challenges with rare diseases is that there are very few specialists that will focus on your particular rare disease. So, and more often than not, they may not even be in your network. I go to the Mayo Clinic for myself, and it is fortunately because I have gone through the years of bureaucratic insurance policy, it's covered, but it took 9 years. So we would like to shorten that for other people.
Well, and as I've seen the story bounce around the last year or two, where a young child under 3, if she gotten a certain drug by the time she's 2 or 3, she could prevent a lifelong disability. But the insurance company wouldn't pay for it, but instead they opt to pay for her care that could be 10 times as much, going beyond, her treatment date.
And that's one of the things about this particular policy is that we actually think that it would actually save insurance providers money, going straight to the person. Eventually, they're going to have to go to the specialist anyway. So, why pay for all the steps in between? And you can provide better care. And like you said, a lot of times things are preventative, so you can actually, provide care that may prevent, a disability that may be more costly later on in life. So that's one of the benefits of this particular policy change that we're hoping to pass this legislative session. And then another policy change that we're hoping to enact this year is regarding the Minnesota Human Rights Act. So the Minnesota Human Rights Act is actually one of the most progressive and oldest human rights statute legislation in the country. It predates the Americans with Disabilities Act by almost 2 it was passed in 1973. Americans with Disabilities Act was passed in 1990. And so Minnesota had a lot more protection for people with disability well before it was national on the federal level. However, there is a particular section of the ADA that has language that the Minnesota Human Rights Act does not have, and that is regarding the interactive process with employers and employees seeking accommodation, workplace accommodation for their disability.
Okay.
The first question I always get when presenting on this, that if the ADA covers it, isn't that federal? And then doesn't that suit the Minnesota Human Rights Act? And that is true. That is absolutely true. However, there was a recent Supreme Court decision a few years ago that stated that Minnesota, because it is a federal thing and it's not in our statute, that Minnesota agencies can't work to enforce that particular thing. So if a Minnesotan is having hard time getting their entitled workplace accommodation, and their employers aren't engaging in an interactive process and including them in that accommodation process, then right now the state can't do anything about it, but the federal government can. However, as someone, with a disability, more often than not, you're kind of a David and Goliath story, and you're probably not going to challenge your employer and go to the federal government. A lot of times you run the risk of, being fired or let go or anything like that. I've experienced that myself. I mean, I've asked for accommodations and they said no, and I was almost, and then later I found out I was entitled to those accommodations, but I didn't know. They brought
Right.
an HR person. They kind of overwhelmed me with policy talk, and then I just shut down and ran away because I was, there's no way that I was just happy to have the job, and so, but I was entitled to those accommodations, and so that's an example of that. And so, we want Minnesota to be able to be an additional resource for people with disabilities, and we believe that the state is probably more accessible for people with disabilities, Minnesotans with disabilities, and so we want the state to be able to be a resource for them. And then we also believe that it is, it's good for businesses too, because it allows, it can be kind of confusing when you have the, federal law saying one thing and then state law saying the other. And so having, that synergy, synchronizing the law
Yeah.
provides a lot more clear, clarifying, and in a process that businesses can follow, because it is the accommodation interactive process is a process, and if the state lays it out, the state can help small businesses make sure they're going through the correct processes. In my experience, I think most businesses want to provide accommodations for people with disabilities. They don't want to make a person with disability life hard. But many times they don't really truly know the law. They don't know what the interactive process is. So we believe that this really helps small businesses and allows the state to be a resource for small businesses as well.
Okay. Charlie, do you have anything you want to finish off with, or?
No, I think we've had a great conversation here with Trevor, and Trevor, we want to thank you for joining us today. Mark, why don't you close it out here?
Yeah, so once again, this has been Disability Landscape. We've been talking with Trevor Turner of the Minnesota Council on Disabilities and my co-host Charlie Brose. And thank you once again for watching Disability Landscape.